The Congressional Budget Office has signed off on how many millions of people they say will lose coverage if the Senate passes the Republican health care bill. Republican leaders trying to wrangle enough votes to get it passed this week. Can they get it across the finish line and finally make good on their promise to repeal and replace Obamacare? Then the Supreme Court has ruled on President Trump's travel ban, and this case could have wide-ranging implications on the scope of presidential power. We're going to look at the legal and the political aspects of this. And Democrats, they've got themselves a messaging problem. You know it's bad when even Chuck Schumer admits it. But the New York senator says he's also got a plan to fix it. Good evening and welcome to RFL. I'm Andrew Whitman in for Richard French. The nonpartisan Congressional Budget Office has just scored the Senate's health care bill, and their numbers, not exactly good news for Republicans. The CBO says 15 million people would lose coverage next year alone, and 22 million people would be additionally uninsured by 2026. The only silver lining is that the plan would decrease the federal deficit by more than $300 billion over the next decade. Senate Majority Leader Mitch McConnell hoping to get a vote this week before the July 4th recess. GOP leaders have tweaked the bill, hoping to win over some holdouts. They've included a provision that would encourage people to maintain their coverage by penalizing people who let their coverage lapse for more than 2 months. That would replace the Obamacare individual mandate that required continuous coverage. It's unclear whether that is going to move the needle for the half dozen or so Republicans who are not in the yes column, at least not yet.
With the clock ticking, President Trump is cautiously optimistic that Senate Republicans will pass their health care plan.
I don't think they're that far off, famous last words, right? But I think we're going to get there.
But members of his own party aren't so sure.
We should not be voting on this next week.
Republicans can afford to lose just 2 votes, but already 5 have said they are not on board. And at least 5 others have serious concerns. Conservatives say the bill doesn't go far enough to repeal Obamacare.
The Obamacare subsidies in this bill are actually greater under the Republican bill than they are under the current Obamacare law. That is not anywhere close to repeal.
But moderates say the bill goes too far, rolls back too much.
I'm also very concerned about the Medicaid cuts and what it means to our most vulnerable citizens.
During the campaign, candidate Trump vowed not to touch Medicaid.
Save Medicare, Medicaid, and Social Security without cuts.
The Senate bill is projected to slash spending on Medicaid by $800 billion. But the White House insists this bill keeps the president's promise.
We don't see them as cuts. It's slowing the rate of growth in the future and getting Medicaid back to where it was.
But at least one Republican governor disagrees.
That over a 10-year period, Medicaid funding will be significantly curtailed.
And across the aisle, Democrats aren't budging.
We are doing everything we can to fight this bill because it's so devastating for the middle class.
All right, so let's get to our panel. We're joined tonight by Dominic Carter. He, of course, political journalist and author. And on the other side of the table, Jeanne Zaino. Jeanne is a professor of political science at Iona College. She's also a senior advisor at the consulting firm Applied Techonomics. So the House bill kicked 23 million people off health insurance. 23 million people would lose their coverage. President Trump called that mean. Now we have the CBO score for the Senate's bill. It would kick 22 million people off of health insurance. So, Dominic, I guess it's 1 million people less mean?
I think it's not a laughing matter, so pardon me for laughing, because it's actually quite sad as an American. I'm not talking as a journalist right now, as an American, in terms of what the proposed debate over health care. Your numbers, and you are right, the House version cut 23 million. Ooh, the Senate comes along and improves the modified version, 22 million. You're going to save what, 600 million over 10 years, or 300 million over, $1 billion over 10, whatever the number is. All we're doing is robbing Peter to pay Paul. You save money in terms of the federal deficit, but what's going to happen to emergency care? Oh, and we're cutting Medicaid, by the way, substantially. So what's going to happen to all of these Americans with cardiac problems, diabetes, high blood pressure? What's going to happen?
That's what we've been hearing from Democrats and people who have been concerned this entire process. Jeanne, what's the sales pitch for the bill? Give me the Republican pitch to fellow Republicans. Here's why you need to vote yes.
You need to vote yes because we have promised to do this for 7 to 8 years, and if we don't put this on the floor and do this, we are going to look like we were making empty promises. And oh, by the way, we need to move beyond this so we can do other things. That's really the pitch that's going on. They made a promise, and
merits they can sell it on? Or is it just that we promised we would do this, now we have to live up to the promise?
They promised they would do it. They have to live up to the promise, because in American history, anybody who owns health care is on the losing end of the politics of that thing. Mitch McConnell knows that. All Republicans know that. And if you look, they're getting hit from conservatives and they're getting hit from moderates. And of course, they're not going to have any Democrats come along on this thing. And oh, by the way, you know, this inflamed rhetoric of the Democrats, let's be clear. Listen to what Rand Paul and the others are saying. The conservatives are saying, you've only gotten rid of 2 of the mandates in Obamacare. There's about 12 mandates in Obamacare. This is a watered down version of the 2010 Affordable Care Act. This is not a repeal. This is by no stretch of the imagination a repeal. This is, let's try to get something that we could possibly cobble together or threaten enough people to get votes to push it through. And that's why it's not going to satisfy anybody.
But the tweaks that the Republicans made on the bill today before the CBO numbers came out, and then the CBO numbers at 22 million people, that's probably more likely that they would lose moderates than that they would lose conservatives based off of what we've seen today, correct?
Yeah, because they need the conservatives. That's their real problem, is that they need to hang on to those conservatives. So absolutely, they're going to do everything they can to try to hang on to those. I think they're going to have a really hard time just getting, just allowing 2 to leave. They have to allow Dean Heller to leave. They're not going to get a Rand Paul, and there's about 3 to 7 others that they may lose.
Well, I was just going through the list of the moderates. Susan Collins, who is the moderate from Maine, she wants to be the governor of Maine, so she's going to be careful about taking too unpopular a vote on something like this. Dean Heller, you mentioned, he's dead man walking in Nevada at this point. Capito in West Virginia, Murkowski in Alaska, Cassidy in Louisiana, all of their states went for big expansions of Medicaid. Now they're going to be left holding the bag. I mean, it does seem like it's going to be more difficult for the moderates, Dominic, to hold the line than it is for the conservatives at this point.
They are literally going to be left holding the bag, with the sentiment being that, as the professor just articulated, we have to vote for this, we promise this, we have to be able to say we delivered on our campaign promise. And so, in other words, survive now, and you may lose in just a very short period of time. So in other words, walk the plank for the party, and we'll live to fight another day when it comes time right around the corner for your reelection. But those moderates that you mentioned, I view this as almost a poison pill for the American people based on the merits. And if you've got to run on this, you've got a tremendous problem.
A couple of other numbers I want to get to. First of all, we told you the 22 million people that the CBO says would lose insurance. 4 million people who have jobs would lose their insurance through work next year. That's just next year. Let's go to the poll numbers, and we've seen that it's losing momentum as we go from, first this is Obamacare versus the Republican replacement plan, more favorable to Obamacare than it is to the Republican replacement plan. There's also the support between since now and when the Republican bill first came out. There you go. 67% of Republicans supported the bill in May. Now that's down to 56%. How locked are these numbers, Jeannie? And is the kind of headline that we got today from the Senate, can they move those numbers, make it any worse for Republicans?
It's going to get worse, because let's not forget, they probably won't get a vote, or at least get this thing passed before they leave next week. They're going to go on break, and that means they're all going to be hitting these town halls in their districts. And nobody is going to be happy with this bill. We have yet to hear of any full throttle defense of this bill, even from Mitch McConnell. He basically dropped this thing like a sack of potatoes and ran away, basically saying, you guys figure it out, because he knows he had to get this thing done and pushed through. And in terms of what Dominic was saying, they don't even have a president that they can rely on. This is a president who was very happy when the House bill came out, and then, as you just mentioned, a few weeks later described it as a mean bill. So if you're a Republican, you're going to take a vote on this, you can bet the president is going to run away from you as well. So you don't have a lot of room to maneuver here if you're a Republican.
Mitch, one of the things about this version of the bill is that it has $200 billion more in savings, deficit reduction, than the House version of the bill. That's money that McConnell can spend if he wants to in amendments to try to make the bill a little more sellable to moderates or to conservatives. He can say, oh, you've got a drug addiction problem in Ohio, here's extra few $1 billion to fight that. Oh, you have a Medicaid problem in West Virginia, here's a few $1 billion here to help fight that. Given that, and that there's still jockeying that can be done, balance that against the AMA and the AARP all against this thing, McConnell's pretty good at what he does. Most people don't think he would put his neck on the line if he didn't think this thing was going to get passed. Dominic, does McConnell get this thing passed, and does he get it passed this week?
Based on his track record, he will probably get it done, but there are some that speculate that perhaps again, to the professor's point that he's basically dropped the bag and said, here, you deal with it, there are some that speculate that perhaps he doesn't want it to pass. I don't know. I don't see it passing by Thursday's the deadline, I believe. And I'm not trying to argue Democratic talking points, because Lord knows we could focus on Democrats as well. But what is the big rush? Now, politically, we know what the big rush is. This is a political football with tremendous third rails of politics as it relates to health care, and nobody wants to own this.
But Jeanne, if they can get the numbers down to 1 or 2 senators on the fence, I mean, how does one senator go up against his entire party? The risk of being penalized with committee placements or chairmanship or not getting support or getting primary. I mean, that's really what this comes down to. If there's one last fence-straddling Republican, how do you get that person to not go with the crowd?
It's going to be very, very tough. And we already heard that there's ads out that the Trump group is putting ads out against Dean Heller. So you can be sure that anybody who is against this thing is going to get a lot of pressure from their own party. But as Dominic mentioned, you get pressure now, you vote for this thing. In some of these states, as Medicare is decimated, you can be sure you're going to lose your job overall. So it's a no-win situation for these Republicans who are walking the plank on this one.
Because at the end of the day, as you and I have argued, and the professor, for years, at the end of the day, all politics are local. And so if you live in a state that's depending on these Medicaid dollars for support for health care, and you're the local senator, how do you explain the fact that you went along to get along with party leadership, and now your people that supported the Republican ticket are badly hurting? How do you get past that? You don't. And even if you do a good job of getting past this, your Democratic opponent and perhaps your primary opponents are going to remind voters every day with television commercials.
All right, we're going to shift gears. This was a big day on the Supreme Court. When we come back, we're going to look at today's ruling on the travel ban. Is this a big victory for President Trump or just a temporary reprieve?